Hey, good morning, everybody. We are going to start shortly. Good morning. Just admitting all of you here and happy to have you all here with us this morning. We will begin shortly. We are going to be doing a presentation with Naseeha this morning, and we have Sumaya Puna with us this morning that will introduce Naseeha and what they're all about before we do a presentation with Tariq Ahmed. He's an expert, and we will start soon. We'll give it another minute or two and we will begin. Thank you for joining us. It's a beautiful morning here. Hope it is at your end as well. Right. We will begin any second with our introduction to Naseeha and all the wonderful things that they do. And we have Sumaya today joining us from Toronto, Canada, who will introduce Naseeha to us. So Sumaya, thank you for joining us. I'm really happy that you're here with us this morning. And I'm so glad I was able to have the opportunity to meet with you when you were in Michigan presenting Naseeha to us, which is where I learned of the wonderful work they do. And I am going to let Sumaya tell you about what they do and also to introduce herself and how she got this going. So this is just wonderful. Thank you, Sumaya, for joining us this morning.
Good morning, everyone. Thank you so much for joining this informative session. My name is Sumaya Puna. I head operations at Naseeha. I helped to establish the organization. I founded the education and outreach department of the organization. In addition to the helpline, the education and outreach was an avenue of support for caregivers and families supporting the youth, because what we found was a lot of the advice or voices being amplified from the Muslim community were sort of in conflict or contradiction to the evidence that we were seeing compiled through the helpline platforms. So what we did was we established workshops and seminars at the local community centers around how to equip your children with the information that they needed to sort of navigate their journeys through life. And we started to get different requests from organizations like hospitals. We're now working with a lot of the public school boards here in Ontario, Canada, and we are also a registered charity in the US. So doing more outreach into the US, we receive roughly 400 to 600 calls a month and about 100 text conversations. We also have assisted 147 clients in accessing free web therapy with registered clinicians here again in Ontario. Some of the registrants have been with us for a few years now, and we don't want cost to be a barrier of access for our community. I don't know if Tariq has joined us yet.
I think he will be soon. Shortly, we have an expert today that will be presenting and fielding some excellent, important questions that we have for him today. So thank you for that introduction. I just want to give you a little bit of an introduction as well as to the fact that I've heard that the helpline has been, I was just telling her, a lifeline for many. So this has been a wonderful organization that is now doing outreach in the United States as well as Canada. And just to give you a little introduction, Naseeha does provide non-judgemental and anonymous support for all these experiencing these personal challenges. And as we know, our refugee youth also experience personal challenges, which is why I thought Naseeha would be a great organization for us to hear from. So I'm really happy they're here with us today. And we'll have Tariq Ahmed I'll introduce him as well. I think he's going to be joining us shortly. I'll introduce him a little bit so that you all know what he has for store for us. So Tarek has a Master's of Social Work from the University of Toronto and a bachelor's as well from Ryerson University, two prominent universities in Toronto, Canada. He has had several years experience, providing services related to mental health, crisis intervention, suicide, substance abuse, addictions, clinical treatment, rehab, and also other supportive services. So he's really right up there with providing all these services. And he is a compassionate person. He's client focused and a social worker who applies his knowledge to human behavior. So I'm really excited that he's going to be on board with us. I think he's just running a little bit late and he'll be with us shortly. So this is just great to be able to hear from him and learn about some of the challenges that we can hear about and also apply to our to our own audience and what we are facing with in our lives. So this has been wonderful. So I think anything else about Tarek we should know, Samaya, feel free to share as we wait for him to join us.
Sure. Tarek is our clinical supervisor,
Ah.
and he oversees all of the clinical activities at the organization. I mean, if you guys have any questions, we can also wait for Tarek as well, but I can comment just based on what we've been able to kind of see through our helpline as well.
Right. Do you have Sumaya, mainly that we're dealing with refugee youth?
Yeah.
So I believe that Naseeha's main thing is youth, correct?
Yes, absolutely. I would say our top 3 issues post-pandemic is around a lot of financial insecurity, whether it's housing, whether it's food insecurity. And prior to the pandemic, it was not even, in our top 10 highest ranking issues. And then beyond that, a lot of interpersonal relationships, whether that's with a parent or caregiver or a sibling, or relationships at school, that's a big one. And then whether it's stress, anxiety, substance abuse. We also see a lot of just this past year, I would say, an increase in suicidal ideation, so much so that we've trained our entire team to be assist certified, which is a great training that I would highly recommend for everybody. You don't have to be have a professional background in mental health to be assist certified, and it could really save the life of anyone. I know our counselors are using the tools and strategies through the assist certification every single day.
Right. And if you can just let us know what the helpline number is again, so that we're all very much, you'd love to be aware of it. I've mentioned it too, but it's great to just remind us.
Yeah, the phone number is 1-866-627-3342. And
is that a name? Is it Naseeha
800? It is Naseeha. Yeah, okay. I can respond to the question in you would have to get an assist certified trainer or 2 trainers to come maybe do training do you guys have an office? Yeah, there is a bit of a cost to run the session, but it's through an organization called Living Works. And I believe they're based in the US as well.
That's excellent. That's excellent. Are you finding you are getting a lot of calls or starting to from the US?
Yeah, absolutely. I would say since when Trump was elected to become president, that was when we saw a surge in our calls from the US. And since then, we've roughly received about 50% of our calls from the US.
Excellent. Well, what are some of the states you've expanded to, just so we know and we're aware?
Yeah, we get calls from California, we get calls from New Mexico, we get calls all across the country, Boston,
Mhm.
New York, quite a
Right,
few. Yeah,
right.
yeah.
That's excellent. That's wonderful to hear that. I know that, for refugee youth, we're facing specific issues. And if anybody would like, before Tarek, sorry, I believe Tarek is a bit delayed, right? He is going to join us pretty
It
soon.
looks like it, yeah.
Yeah.
I
So
can
we are,
message him.
yeah. So while we wait for him, if anybody has any specific scenarios that you're facing or issues that you're facing, I would love for us to get that out there in a comment or in a question so we could help. But I know that before I fielded some questions as well from some of you, and I did get I did get some of those questions, and we can ask Tariq Ahmed these questions when he joins us. But I know that especially for refugee youth, we are facing some very different barriers like languages and communication,
Yeah,
culture shock, navigating through a foreign education system. So, as our youth face these, we seek some professional assistance and advice,
of course.
and hopefully we can, ask some of these questions and have Tarek present to us about these. So I know last time that Sonia had done a great job of presenting and addressing some of these questions as well. So,
Sure.
even it comes down to even basic things like some of our youth facing culture shock in terms of food, right? So,
Yes,
and then that can do something to the
you're
psyche.
right.
So all of us are here as, in this, as experts as to, our agencies, the staff that are dealing with it, they're doing such great jobs and are
Absolutely.
here to learn and address those. And, you become part of that organization that we reach out to as well.
The landscape. So we've
Yeah.
actually been working with the YMCA out of St. John, Halifax, I believe, St. John's, and then New Brunswick. We've also had some experience working with the newcomer population as well. There have been a few suicides reported, and unfortunately, that leaves some of sometimes there's wives or children as well. But, the work that we have been actively involved in is around creating a sense of safety and belonging as they sort of integrate into North America, because, really they're coming to the table with so much
Yes.
that it's hard to adapt quickly, as resilient as they've been to this point.
Mhm.
I think for a lot of individuals too, this is the first time they're feeling a sense of safety, and that could feel different, right, than what they've been accustomed to as well. So it takes time. I was just recently over at a friend's house this past weekend, and she adopted 5 children from Morocco, and her youngest group of twins, I think they're about 5, were refused access to public education because the school system felt like they, were not safe
Mhm.
enough to kind of enter into the school system. I know there was some violent incidences. They were both flight risks. And so, who is supposed to be like taking on that onus of responsibility? It's
Mhm.
really quite challenging for a lot of the adults involved in this system. And
Right.
so if we can kind of work together and layer our community interventions, I
Mhm.
think would have better outcomes.
Right. Right. Yeah, I can see that. I mean, for a lot of our refugee youth too, they're facing, the distance from their families
Of
as they're
course.
here or waiting to rejoin their families. The lack of, regular communication and being able to see them, that can be part of some of the stressors and trauma that they face. And and for some of them, sadly, the fact that they may be the only or few survivors of their own family,
Yeah.
so that survivor guilt that you sometimes feel as well, that I notice in some
Right.
of our youth. So these are some areas that I feel like Naseeha can really address and possibly, help us with, in terms of knowing, well, what are some skills that we can use to reach out
So
to these youth.
we've also done group circles as well with
Mhm.
newcomer youth,
Yeah.
and it really is just a forum for open discussion
Mhm.
for our young people to kind of talk about some of the challenges they're facing, right? Like
Ah,
in this sort of process. And some of the things that were brought up were things like missing their home, right? And not realizing that, when they kind of looked over their shoulder, that was the last time they saw their ancestral home and they'll never see it again, right? Or the
yeah.
fact that maybe it's inhabited by someone else now.
Yes.
I remember another youth mentioning that she felt an immense sense of guilt
Mhm.
because everybody back home
Mhm.
feels like you got out, right? And you
Mhm.
should have this beautiful life right now. But she's like, it's actually really hard here, right?
Mhm.
And they're thinking, they're all looking at her like she was the lucky one that got out, but that doesn't really acknowledge the work involved in building
Yes.
a new life as well.
Right. Right. Absolutely. Yeah. There's so many layers to this, isn't there? It certainly presents many challenges, of course.
I'd love to hear
Mhm.
what other people are experiencing in their work, in their agencies, and some
Yeah.
of their programs.
Mhm. Yeah, definitely. Yeah, if you are open to sharing, while we wait for Tariq Ahmed to join us, apologies that he's running a bit behind this morning as something had come up, but I'm sure he will join us soon. So if you'd like to share any comments or field any questions with our, Samaya herself is an expert, we can certainly, address that while we wait for Tariq to join us. There are so many layers to, of course, what you're all facing as well, and what you're all doing in a different capacity. We have foster parents here as well here that have youth with them that are facing many challenges as they incorporate them as part of their family. So yeah, please, if you feel open to sharing and asking any questions that you might have, uh, go ahead and put it out in the chat. Um, or unmute yourself and ask as well. Either is fine. Yeah. Or raise your hand if you're doing this. I'm trying to see if there's anything on the chat. Nothing there. So like I said, Samaya, there's a lot of different things that that foster parents face when they have a youth, come on board in their family. And one of the things that I'm sure they're dealing with is also the different systems that we have in place in our life, in our family, to allow them to adjust, and it comes from, like, I'm sure everything, even down to the basics of, clothing, to adjust to different clothing, to adjust to eating in a certain way, or maybe even I remember talking to a youth, to even the time that we eat, right? The time that we eat here and the time that they had dinner, possibly in their homes. So even that can become a form of stressor as they adjust. So
Absolutely.
there's been a lot of different, and I'm sure that parents who have these youth with us have been dealing with some of this, and going to school, the timings of school, adjusting to and acclimating to American life and American culture while trying to retain their own identity, which can be difficult.
Absolutely. I
Yeah.
think that what we found, again, through that circle that we did
Uh-huh.
with the newcomer youth, was they really valued that sense of community
Mhm.
because they're coming from a collectivist environment
Yeah.
where you would always have the house filled with visitors. and they missed that sort of sense of community. I think growing up here in North America, we don't have that same level of exposure to people always being in our house, always stopping in for tea or dropping something over. But that's really what they are longing for, to sort of feel welcomed and embraced. And if they can be that, support for each other, I think that would be helpful in just kind of calming them down a little bit and giving them that space to kind of, retain their identity, but still synthesize it in a way that is doable for a North
Right,
American system.
right. I see a question there from
Yeah,
Maliha. Maybe you can
sure.
see if you can help.
Yeah. So
Yeah.
I run a mentoring program for refugee youth. Are there any tips for mentors on how they can engage with youth who come from trauma backgrounds? Our mentors are not trained mental health professionals. They are community volunteers. Any advice would be helpful. So I think mentorship is actually a critical link that we should provide more, what's the word? Like, give more weight to that model, because, I think it gives people a sense of grounding and anchoring here. I would say, whether it's art, whether it's hobbies like sports, all of these hobbies can be tools that can help to engage conversations and then ultimately build trust, whether it's working on homework together. I know, a lot of the work that we're doing with the newcomer population, some of the young people are really struggling academically, and don't have a lot of formal education. And I think specifically for, non-trained mental health professionals, all of these tools can help to elevate someone's mental health, but in a non-clinical way. I think once they're able to kind of, feel more confident doing math, that will help them feel like they can go to school and not, you know what I mean? Like, be the odd person out, whether it's helping with literacy or digital literacy, or language tips. I think all of these sort of rudimentary skills will help you build your resiliency and your capacity to kind of like socialize and build networks together.
Yeah, thank you. That's these mentorship programs go a long way.
They
Um,
really do.
they make a huge difference. So that's a great question, Maliha. I see that Amanda has a great question for us too to think about, and so the issue of these youth, as you see, who want to send money back to their home and families,
Yeah.
and not saving for themselves, and as a result, not being able to enter independent living in a better way. So, a suggestion on how to have these discussions or help them understand that they also need this support for themselves before they try to help, their families back home.
I think it just goes back to that guilt piece. I think there's an immense amount of guilt for feeling like they survived.
Yeah.
And speaking to a lot of the young men, sorry, they really feel like, if they could work 14 hours a day to build a better life, that's just their tax for living here, but I think it'll take time to,
Yeah.
right, to just kind of realize that you were here for a reason, right? Like, you
Yeah.
were selected connected for a purpose. And while that purpose is helping your family, it's also having a good life, right? And building a life here.
Yeah, I think that's a very good thing you just mentioned, Samaya, is the fact that the guilt of being here and them having a better life as opposed to what they feel their families are suffering from. One thing to let them know is it's okay to have a good time.
Yeah.
It's okay to save for you. It's
Yeah,
okay
for
for
sure.
you to think of a brighter future for you,
Absolutely.
because their families or their parents or whoever they left behind would want that for them. And
100%.
I remember having this conversation with one of the youths, that I went out with, and part of her guilt was, I don't feel like going out and buying something nice for me, and I remember telling her that that's okay, enjoy it, because
Yes.
wouldn't your mom and dad want you to, right?
Yeah.
So I had a conversation, Amanda, great question that you asked, with her about this, and she thought, yeah, if I tell my mom and dad about this, that I, treated myself, they will be happy that I did this for me. So
Absolutely.
I think that's one way to get through to the youth, that for their bright future, they've been sent here by them for that reason.
Absolutely. And you want to
Yeah.
constantly reassure, right?
Yeah.
And reframe the way they're thinking, maybe challenge some of those perspectives. Because
Yes.
sometimes it could be like a cognitive distortion, right? Where
Yeah.
they are having a thinking error, but they don't realize that they're
Yeah.
really kind of stuck in a thought process that's not productive.
Right. Yeah. So it is. And also, whatever they do for themselves has an impact on the future of what they might be able to do for their families. Right.
Absolutely.
So Amanda, I would say, yeah, I mean, the discussion could be what Samaya suggested, and what I sort of went through with this particular youth, is to say it's okay, spend on yourselves and have a good time, and save for your independent skills so that you can make your family independent down the line.
So I'm seeing a great comment from Maliha in the chat as well.
Mhm.
It's financial literacy has come up as one of the critical skills needed by refugee youth, because I think they are thrust into independence so suddenly that they really haven't picked up those skills. We're actually doing more sort of like awareness campaigns around financial literacy, because you even see adults really struggling with this. And I think sometimes we're expecting people to move from a place of scarcity to a place of security in a very rapid way. And of course, people are going to make mistakes along the way, but the stakes are so high when we're talking about finances, because you can make a few wrong decisions and you could really be suffering from those consequences for years to come. I would recommend, doing, whether it's at your agency or at a community center, doing like a 6 series, like 6 sessions, where you're just kind of talking to them and equipping them with information around what are the consequences of bad decisions, and what does budgeting look like? What does deferring your reward look like, and what are the benefits of not sort of going for that feeling of satisfaction of like paying for something that you can't afford long term, right? And all of these things can be life skills that they take with them as they kind of further integrate into the larger community.
Absolutely. I had another question that I had someone had sent me for this particular workshop, and we could maybe try to address that, which is, as we know, I mean, these are troubled youth and they come here deeply troubled. But the question a foster parent asked me is, what are the parameters of considering the trauma they faced, what are the parameters of acceptable and unacceptable behavior, and how can you work with those behaviors so that, you know, it doesn't have an impact on them, and then you as a unit when you're trying to help them, right? So
Yeah.
there are behaviors that you should be able to tell a trauma-faced youth, well, this is not right, and this is how to address it.
Right. Yeah.
Yeah.
I think, you know, like you guys all deserve an award for the work that you guys are doing. It is so, so remarkable. And honestly, like, I don't know if I could do what you guys do. It is like really life-changing. And I hope that you guys can, I don't think enough people thank you for the gap that you guys stand in. I think the important pieces are to just be consistent, to let them know that your love for them is unconditional. But then in terms of, you know, making sure that they feel safe and that they are brokers of safety for the people around them is
Mhm.
also so critical, right? And it's really going to be about setting boundaries in a way that doesn't like take their power away from the dynamic.
Mhm.
Because I think sometimes, you know, and it's about understanding why are you angry? Why do you feel like you need to act this way right now?
Mhm.
What can we do to just kind of, you know, help you get through this feeling? Because this feeling is very temporary, right? It will pass, but let's just kind of take a moment. Sometimes as the adult, you have to kind of walk away from the situation too. If you feel like everybody's emotions are getting escalated, uh,
Yeah.
you want to model healthy behavior as well.
Yeah. Right. Right. Those are great tips, and I'm sure that we could learn or have coping mechanisms that we can instill,
Absolutely. For
right?
sure. For
If
sure.
for a certain behavior that may be out of place, or a reaction that's out of place. One of the things to maybe teach are coping mechanisms.
Yes, absolutely. Definitely. That would be more
Mhm.
Tarek's domain. I
Yes.
tried
Yeah.
to message him.
Yes.
I'm sure something, he
Yeah. Has
does
come
go
up.
with students at the
Yes.
student center.
Yeah.
So I have no doubt it's urgent that he's
Yeah.
dealing with.
Yeah, he was dealing with something that had come up. So thank you for all your patience with this. So if Tariq Ahmed is not able to come on board, what we can do is have this discussion and maybe even have him. I can share his presentation that he was going to present today,
Sure.
and we can obviously listen to him and hear him later at another time as well. But yeah, Maliha, that's a great thing. That you just said. Yeah, it is so important that role modeling healthy behaviors, as caregivers, and not experiencing the burnout that especially foster families experience and staff experience. It is such a daily thing, right? It is such a daily for us too, as we address these issues that come up. And then you can have something pop up that you're not even aware could happen. So to deal with it in an intelligent way that doesn't take away from them and from us, because for many of these, especially foster parents, and we have family, we have our own children, we have their children that have now become our children. So it is certainly very, very challenging, and the burnout I can see could be difficult.
You
So
know,
yeah.
one thing I have heard from families who have gone through some of this process is that they find a lot of positive affirmations
Mhm.
really work right before bed.
Uh-huh.
Things like, I love you, I'm so proud of you,
Mhm.
you're enough, what can I do better? And not only does that help the child when
Mhm.
you're saying it, but when you wake up in the morning,
Mhm.
it also helps to reframe the relationship, because sometimes, I mean, I have a 13-year-old. There are challenges to the parenting process, right? And sometimes it can be very taxing, but when you kind of say these daily affirmations, you're also reminding yourself that, like, you know, this is what I'm here for, and this is the reason I'm doing this, right?
Yeah, I think you're right. That is a way to keep yourself grounded, right? Too.
Absolutely.
So having this kind of discussion and affirming for them and for yourself that at the end, what you're trying to do is, you know, help them and help yourself and be there for them. And because you've taken out such great responsibility for them as well. So repeating that with them and going over that will give them that reassurance as well. So,
And actually, a father
mhm,
was mentioning to me that he was
mhm,
sitting with his son right before bed, and he said, "I'm so proud of you." And his son was like, "Proud of what? Like what specifically?" And he kind of like mumbled through it because it was the first time he had tried this exercise on the recommendation of his wife.
mhm,
But it really, you know, I think whether young people want to admit it or not, they
mhm.
want to know that you're taking an interest in their life and that you're paying attention, right? And sometimes we as the adults don't do a good enough job of letting them know that we are invested,
Right,
um, right? And not just financially, but
right,
emotionally, we want to see them succeed. Um,
right.
and right, like it's important that they're winning these awards at schools, and that they even showed up for school, right? Or that they took a test, for example, right?
Yeah, right. Yeah, that's a good point because I did have a foster parent share with me that one of her difficulties had been to have, you know, her youth go to school because
Yeah.
there's been that, you know, hesitancy there because of the culture shock, obviously.
Well, and I mean, we've heard of a lot of incidents of bullying as
Mhm,
well,
mhm,
whether it's around the clothing piece or the language piece. Um, there's some violent incidents
mhm,
happening at school.
mhm.
Um, and some of these kids, it's the first, our schools are massive,
Right.
absolutely huge compared to what they've been accustomed to, right?
Oh,
So
yeah. Mhm.
that that can be very daunting, and oftentimes the teachers and the staff are not always safe spaces for them.
Yeah.
So we can be advocates for our young people as well.
Mhm.
Um, and, you know, understand that sometimes it's going to take time, right, for them to feel safe in places. So just showing up is the first step. Consistency is a big one, I think, at this stage as well.
Mhm.
Um, and that's kind of all we can really hope for until they can allow themselves for better outcomes.
Yeah, absolutely. And turn to some of the school experts maybe to use how they deal with that. And so they have maybe some programs for the youth attending the school to give them a little bit more attention as
Yeah,
they enter and as they enter the school system. Um,
for sure.
um,
And I think making these young people believe that you believe in them, right, is
right,
really the biggest like step forward that you can give them.
right. Yeah, I can imagine because that's a great point you made that the school systems here would be so foreign to them coming from where they're coming from and how the classes were, how the sizes were, how the lessons were conducted. It is all such so new and so unique and very, very different from the school structure that they, you know, that they had.
And I know
Mhm.
one of the public school boards here
Mhm.
had made arrangements with one of the local faith centers or mosques
Mhm.
to provide free after school tutoring to
Ah,
these certain populations, because
Mhm.
we know tutoring costs lots of money. We
Mhm.
also know that there is a bit of a learning gap there that needs to be addressed for the learning to be buildable, right?
Yes.
So that is something that you can work on with your local community groups and schools as well.
Right. And I have to say, for the number of people that are here online, we have such amazing agencies, staff, and foster parents with us today that do so much to address all these, you know, unique things that come up, that they find ways to help them. And that is, I think, is already something that is so remarkable for these youth that are with them and under their care, that, to find cultural items for them, to find cultural clothing for them. And
Absolutely.
that's hard. I'm sure when the youth wants to wear their traditional cultural clothing, many of you go out and find that. And so I think that it's just beautiful that that keeps on going, that so that youth to have that identity intact. That's also a great way. So if you are facing this, and I know some of you have faced this, and you reach out to MFCA, or you reach out to the staff contact so they can reach out to others to help you, I think that is one way to lessen the trauma, I guess, or lessen what they're facing as as they come over here and enter life here in the US. So definitely. So if you're facing any other issues that maybe Samaya can help with, I feel that I believe that our guest today, Tariq Ahmed, may not be able to join us today,
Yeah.
but certainly we're going to ask him to share his presentation, and perhaps bring him back when he can join us. But these are such important questions that we talked about today. And if you have others that you'd like Samaya to address, or that we can, help with, let us know. These are daunting stuff, right? And you've not been daunted. That's what's so impressive, that all of you who are here today with MFCA and joining us in these workshops, you come here to bring your own expertise and to figure out tools that you can use to help. And so it's just wonderful to have you here, figure out what are these tools. And I always feel there are tools, there always are, I believe, right? Isn't that where you run into, Samaya, that you feel that help is always possible?
Absolutely. It's just,
Right.
I think that's a Harry Potter quote, right? For those
Yeah.
who
Yeah.
are reaching out.
Yeah. So important. So I think the capacity for change is always possible. The capacity to embrace uh, is always possible. And I'm seeing that with our foster youth, that they sometimes they make lightning leaps to embrace, and they are just so appreciative of all of you, and in trying to help them. And I think they recognize that. From my own work, from my end, I see it, how appreciative the youth are, and how much you do to support them by reaching out to MFCA, reaching out to other organizations that are providing support. And I think to continue to do that in our work is essential.
Yeah, I was actually just in a conversation with someone last week, and they were saying
Mhm.
that there's a formula
Mhm.
for resilience, and that formula is P plus R
Mhm.
equals S. And what that is pain, because we all go through pain, it's part of the
Mhm.
human condition, plus your resilience, or sort of level of resilience is equal to your response to stress, and
Mm.
how you face stress or adversity. So what we can do in building these tools and skills is to have a better ability to increase resilience in our lives and with our young people. But it is a skill that is very much buildable. And we can't really determine how much pain we're going to kind of undergo or how much stress we're going to face in our life. But what we can control is our ability to react. And the hope is that it would be with resilience and with gratitude. So, I'm sure you guys know of tons of tools and tips to build gratitude and resilience, but we're always here. Feel free to reach out to our helpline as well. We have social workers and nurses who access our helpline just to kind of learn about how to support young people in their lives. We also have the free web therapy if you feel like you're a young person. Actually, I apologize. I have to retract that. That's only for residents of Ontario right now, but we're hoping to establish a very similar model in the US as well. And then we'd love to be able to do workshops on site as well. I know Shona and I have spoken about it, and hopefully we will be down on your end of the border soon. But thank you guys so much for this opportunity.
Yeah, thank you, Smaya. This is great. I think one of the things that we're all here for that is a tool in itself, I just thought of is knowledge. Equipping ourselves with knowledge is in itself a tool to help each other and to help those under our care. And I just think that that's what we need. I just ran into a quote as I was doing our work that we're all doing. And I thought I'd end with that, which is when we meet adversity with compassion and a desire to validate and heal rather than to judge or condemn, we manifest communities of care that empower people with self-knowledge and agency. So that is a powerful one. I was thinking about that's it. When we're feeling that compassion, and all of us are so compassionate in the fields of what we're doing. I think when we are using that, we will help heal people. I think we will make that difference. I see that difference in everyone that all of you reach out to, and hopefully everyone that MFCA reaches out to. I feel that it's a healing process, and the healing process can sometimes takes time. And so certainly I have to say kudos to you all for helping in that healing process and helping MFCA do the important work that you're already doing, and to help people like Sumaya in her field with Naseeha help others. So thank you for joining us today. If you have any other questions or comments, let us know. And we can go on from here. We can try to bring Tariq Ahmed, who is an expert, back when he's available. I'm sorry, apologies from all of us that he couldn't make it, but I think we had a beautiful discussion though, and we're hopefully able to help you all, with some of the things you're facing. So thank you everybody for joining MFCA. Thank you Naseeha and Sumaya Puna for joining us and helping us with your expertise.
Thank you, guys.
Thank you. Have a wonderful day and week, and enjoy that sunshine. Thank you. Thank you, everybody. Have a wonderful week. And we hope to see you again next month.